This is Heart Rhythm TV. I'm Oliver Monfredi, and I'm delighted to be joined this afternoon at HRX by Dr. Lakkireddy. Dr. Lakkireddy, I'm sure you're all aware, is the Executive Medical Director of the Kansas City Heart Rhythm Institute. Dr. Lakkireddy, welcome.
Thank you.
Thanks for joining me today.
It's a pleasure to be here.
I was fortunate to spend some time yesterday afternoon in a session that you were chairing about ambulatory surgical centers, and I thought there was a lot of it which would be of interest to our audience.
Yeah.
So I want to start off by asking you, to give us an update of the general state of ambulatory surgical centers as they pertain to electrophysiology in the United States today.
Well, I think with the recent proposal from the Center for Medicare Services announcing the payments for ambulatory surgery center-based catheter ablations, I think there is a renewed interest in this particular subject. Some of the EPs around the country have attempted to do this during the COVID times when access to hospitals was difficult. So at that point in time, they had hospital without walls as a concept where the Medicare has allowed these doctors to perform catheter ablations in the outpatient setting. Yeah. That sort of really became a precedence for what it is. The safety and efficacy data that was generated from that very initial experience, I think, led to this proposal that has been put on the table for CMS to consider for a long time. And it finally, I think, come to fruition. And it's up for commentary period now, and I think most likely this is going to go through. And I think that's where the excitement comes from, right? So that's sort of the background of how EPs are getting pulled into this whole ASCs as a concept. Our colleagues in other subspecialties like orthopedics and general cardiology, interventional cardiology, gastroenterology have experimented this, some very successful and some not so.
Right.
So what is going to be interesting here is when you really look at the EP workforce, about 5% of the workforce is in an independent practice setting, where the remaining 95% of us, including me, we're all in an employed setting. So how is this going to pan out for an EP physician that's employed by a health system or a hospital versus those that are in private practice? So I'm not really sure if the uptick of the ASCs is going to be like a frenzy, but I think it's going to be a slow uptick based on many factors that go into the mix, right?
Right.
So for those docs who are in private practice setting that are not affiliated with the health systems, I think they have more flexibility and freedom to really be part of this ASC movement, and they will probably pave the way for many things that are to come.
Absolutely. That leads me nicely to my next question, which is, what are the benefits of ASCs, not only for providers, but also, importantly, for patients and also for hospital systems if the ASC itself indeed is owned by the hospital system? Yeah,
I mean, I think it's a very good question, because when you really look at it, there is always a perspective from the stakeholder that's involved in it, right? So we should put the patients first, and I think that's an important thing that we have to assess now. So right now, depending on which part of the country you're talking about and which town and which demographic you take, the access to care is an issue that needs to be resolved, right? So an access to care issue from a patient perspective, because you don't have enough electrophysiologists, or you don't have enough centers that are performing these procedures, or the existing centers may not have the capacity to accommodate for more procedures. Anesthesia coverage could be a problem, lab space could be a problem. So the ASCs as a concept, I think, will democratize the very specialized electrophysiologic procedures that historically have been part of the hospital-based care to more of an outpatient setting, where you may be able to open up these services in less gentrified health spaces and take it into the community, right? So as a result of which, there is a great possibility that you would significantly increase the access to care for a lot of our patients, especially in the rural areas or in the real urban areas where there is a lot of competition and access-related issues. And when you really look at the providers, right, the physicians and the physician workforce and other allied health professionals that are part of the team, this is always going to be interesting, right? So I'm not really sure if it's a major benefit for the healthcare professionals per se, There may be a perceived sense of independence from the physician groups because you're running your own show. You're able to have a better understanding of the operations of the ambulatory surgery centers if somebody is involved in it. And it will give you the opportunity to remain independent and not be affiliated to a health system. But again, there are many examples in other fields like orthopedics and like cardiology, where there are combination of physician as well as a health system co-owned facilities. That could be a real factor too, right?
Absolutely.
So from a work perspective, I don't think it's going to change a whole lot. From a financial perspective, I don't think it's going to change a whole lot, except that where you operate really becomes different.
Yeah.
From a health system perspective, what are the advantages, right? As I said earlier, if you as a hospital, you don't have enough space to build another lab, you're having problems with anesthesia coverage, and your hospital-based costs are significantly higher, and ASC will actually provide you a relief valve where you can actually open up some of these ASCs where you're able to provide the same services, maybe at a lower cost, much faster.
Absolutely. Bearing all that in mind, what are the dangers of ASCs? You know, how do we ensure that we can expand electrophysiology services into ASCs and keep our patients safe?
I think it's a very important question and a critical one that we all have to ask ourselves. It's the other side of the coin, right, that nobody wants to talk about. What I worry about is the quality of the care that we can deliver, right? And we have shown it with other subspecialties experience and also our own experience during the COVID time that quality can be maintained, but provided there are appropriate guardrails, right? So this opening up of ASCs and opportunities should not become a race down the pipe, right? So it should not be the race to the bottom.
No.
And that is where I think medical professional societies like Heart Rhythm Society play a bigger role in putting out those guardrails. We just released a position paper on this, how to really do these ablations in the ambulatory surgical space. What kind of patients should you do and what kind of patients should you not do in ASCs, I think is something people have to take into consideration. So when you really look at it, the patient should be aware that most of these ambulatory surgery centers do not have a surgical backup. If you don't feel comfortable having a procedure inside a setting where you don't have surgical backup and it may take 60 minutes for you to go to the nearest surgical site to have an open chest to fix a problem, right? The consenting process has to be foolproof. The shared decision making has to be very clear so that patients know what they're getting into, right? So that is one piece that I think we can successfully navigate, but there needs to be an engagement and participation of the operating physicians and be prepared for that. What are the other potential dangers, right? So if we look at it from a health system hospital perspective, right, there are certain service lines that are that generate revenue in an environment where most of the health systems or hospitals operate on a 1 to 5% margin. We have to realize that if we took away the most productive service lines of a health system or a hospital, the other systems, the other services are going to take a big hit. We've already seen in many facilities across the United States, you don't have endocrinology available on the inpatient side.
Right.
In some hospitals don't have immunology, rheumatology. Some hospitals don't have even infectious diseases, right? So what I worry about is this slow decline in some of the essential services that are very important for the comprehensive care provision for our patients, and a slow removal of the revenue sources would impact the hospital's ability to provide overall around the clock care.
Absolutely.
And the other aspect to look at it is this may be inevitable to some degree, right? So in a sense that if Medicare would come out next year and announce site neutrality, the hospitals and the health systems have no choice than really embrace this.
Yep.
And then maybe voluntarily push a lot of the care to ambulatory surgery centers because there is no other way you can sustain operating at a 25% pay cut
right.
on what you would be operating at.
Right.
From a physician perspective, I think you also have to realize that you don't have the same protections that you have when you're operating in a facility that has a surgical backup, right?
Sure.
You're on your own, out in the wild, wild west, when you have a complication, and there are legal risks that come along with it. And that's something that I think one has to be very cognizant about.
Absolutely.
From an industry perspective, this is what I worry about, right? So electrophysiology has enjoyed unprecedented innovation in the last 3 decades, as you know. And to some degree, if we resort to the bottom line based approach, where everybody wants to save money and start looking down the barrel as the reimbursements continue to go down as they have been currently, then the ability to innovate goes down, right? Industries desire to innovate. Industries desire to really bring in these new tools and toys that have really brought in incremental improvement in the quality of the care we were able to provide, I think could potentially take a hit. If you look at fields like orthopedics and if you look at fields like gastroenterology, you can clearly see the stunted growth and innovation in these fields. And I worry about that. So I think that's something for us to really keep in mind.
Well, that's Lakkireddy. I mean, that's been a fascinating insight. I really appreciate it. And thanks very much for joining me today. It's been great to chat about ASC.
Thank you very much.
It's going to be a fascinating time.
Thanks
indeed.